A study by Sesonke published recently in the New England Journal of Medicine shows that a second dose of the J&J vaccine provides significant protection for individuals who have received it. The study also shows that a second dose of the vaccine protected participants from vaccination. For more on this, we're joined by the South African Medical Research Council CEO, Professor Glenda Gray. Professor Gray, good evening to you. Thank you for your time. Of course, many South Africans were introduced to the Sesonke study at the beginning of COVID-19 when different vaccines were being tested, because that was what was rolled out to our health practitioners in this country. Tell us more about how you've built on that study in the recent year or so.
Yes, I think we're very excited. So we were able to compare 2 doses of the J&J vaccine in our Sesonke participants as compared to 2 doses of Pfizer. And so we were able to show that both Pfizer and J&J work very well if they were given as 2 doses. And in our study again in Omicron, during the Omicron period, we showed that both vaccines were similar, above 70% protection against severe disease and ICU. So again, the government's choice of J&J and Pfizer are good, and they both seem to be comparable and are working equally well. So I think we're very happy with results with the Omicron period. Now we're going into our 5th wave, and we'll be evaluating further the impact of people who got a 3rd dose of J&J or got the Pfizer on top of the Sesonke. So I think we're very happy. It's good news that the vaccines do protect against severe disease and hospitalization, ICU, and death. Obviously, they protect less well against infection. And as we know, there's a lot of infections happening, reinfections, even in people who have been vaccinated.
Professor Gray, when we talk about the participants of the study, are they the same individuals as what you had in the first phase, or are you diversifying them as you go along? And how are you picking participants?
Yes, that's a good question. So all the healthcare workers that were enrolled in Sesonke 1 were offered a vaccination with the J&J vaccine late last year. So around 250,000 of these individuals took up the 2nd dose, and others waited for the Pfizer boost. And so we were able to compare those who got 2 doses of J&J with other people who got 2 doses of Pfizer, and were able to show that both vaccines worked equally well. Subsequently to the 2 dose of J&J, healthcare workers have gone on to get additional doses, a dose of maybe a mix and match with Pfizer, or a 3rd dose of J&J. And so we will be able to evaluate the impact of this 3rd dose during this next wave. And so we will look at all breakthrough infections and see of those who got breakthrough infections, how severe they were, and how well the vaccine regimen now, which will be 3 doses, during this 5th wave, fared against the new variant BA4 or BA5.
And you're bringing me to my next question, Professor Gray, the issue of breakthrough infections, because it tends to be something that South Africans speak a lot about. But in terms of the actual numbers, what is the rate of breakthrough infections, especially for a variant like Omicron, amongst those that have been double dosed or double vaxxed?
So that's an important question. So these vaccines protect against severe disease and death and hospitalization, but they protect less well against just infection. And so we see low rates of vaccine effectiveness when it comes to any infection. But certainly the vaccines fare well with severe disease, and that's the aim of this 1st generation vaccine, was to try and impact on severe disease and death. Going forward, the new generation of vaccines will have variant inserts in them and may impact more on preventing infection, not just severe disease and hospitalization. So that's where the vaccine field is moving. And I think as you watch the waves appear and people get more and more boosts, we continue to see the protection against severe disease. However, this 1st generation regimens won't protect against any kind of infection. So they don't prevent infection, but they prevent severe disease, symptomatic disease, and hospitalization and death. And so hopefully in the future we will have vaccines that can be used in combination with these vaccines that may protect against infection as well.
There are concerns about, the subvariants of Omicron that we have been seeing and the extent to which, those subvariants may pose a threat in as far as escaping the current immunity. How does that feed into the research that's going into the development of a second-generation vaccine for COVID-19?
So we look at the variants that are emerging. So we're looking at the Omicron variant and looking at pairing that with maybe the Beta variant or with or with the current BA4, BA5, and we look at doing studies to see how that differs from the ancestral strain that was in the original vaccine. And there are companies that are busy working on an Omicron variant. Some are busy working on a Beta variant, and some are working on a Beta and an Omicron variant. And so we believe that these new modalities may impact further on protection against infection, which is important when we're trying to control viral transmission at a community level. And so, we probably will start evaluating these further as the data comes through towards the end of the year.
But ultimately, people right now would want to know that they're still offered sufficient protection from the current generation of vaccines.
They do. So I think that this current vaccines are still important. With the hybrid immunity that we're seeing, both vaccination and previous exposure increases your immune repertoire, which bodes well for future variants that may emerge. And so I think it's important to continue to get vaccinated, get your boosters when you need it, and to make sure that we continue to top up, so to speak, our immunity, so that we definitely hope to increase the diversity of our immune response that will protect us further from death. We don't want people to die. We don't want people to go to ICU or hospital admissions. And now we're seeing, even with this new wave, is that there is still a decoupling of cases with hospital admissions and ICU, which bodes well. We're keeping an eye on the death rates in the country to make sure that